Okay, we are coming back for part 2 of the First Aid Merit Badge book. We are starting on page 38 with muscle, joint, and bone injuries and how to treat them. Muscles, joints, and bones are all involved in helping the body move. Falls, slips, collisions, and even fatigue and dehydration can compromise or injure these body parts. Muscle cramps most often affect the legs, but they also can occur in the muscles of the ribs, arms, and hands. A muscle cramp occurs when muscle contracts on its own and does not easily relax. They tend to happen most when the body is tired and the muscles have not been stretched well. Dehydration, exertion in hot weather, and depletion of electrolytes such as calcium, chloride, phosphate, potassium, and sodium in the body may also lead to muscle cramping. With severe cramping, the muscle may feel hard and knotted. Allow a person experiencing muscle cramps to rest. Often a cramp will disappear on its own in a few minutes. To help recovery, gently massage the muscle and lightly stretch it. If the weather is warm and the person has been exercising, be sure the person rehydrates with water or ideally a sports drink that will help the body restore its proper electrolyte balance. You can decrease the likelihood of muscle cramps by staying in good physical shape, stretching before exercising, warming down, and drinking plenty of fluids before, during, and after you work out. Sprains and strains. A sprain occurs when an ankle, wrist, or other joint is bent far enough to overstretch the ligaments, the tough bands that hold joints together. Twisting an ankle while running is one way a person could sustain a sprain. A strain occurs when muscles are overstretched, creating tears in the muscle fibers. Lower back pain is often the result of muscles strained by overuse or by lifting loads that are too heavy. Assume that any injury to a joint also may include a bone fracture. Use the following procedure to treat sprains and strains and prevent further injury. So your acronym here is RICE, R-I-C-E. Use RICE for bone, joint, and muscle injuries. Broken or dislocated bones should also be splinted. R stands for rest. Stop using the injured part or minimize its use. ICE is apply cold as soon as possible for 20 minutes and continue several times a day as needed. Compression, apply an elastic compression bandage to reduce the swelling. E, elevation, if possible, keep the injured part above the level of the heart to reduce swelling and pain. If someone suffers an ankle sprain during a hike and your group must keep walking, do not remove the hiking boot from the injured foot. The boot will help support the ankle. If you do take the boot off, the injury may swell so much it will not be possible to get the boot back on. Reinforce the ankle by wrapping it, boot and all, with a bandage, neckerchief, or some other strip of cloth. Again, where your neckerchief comes in handy and why you should wear them. Broken bones. A fall, violent blow, a collision, all of these can cause a fracture or broken bone. When you suspect a fracture, do not move the person. Check for the dots. Look for abnormal shape or position of a bone, such that, the word here is deformity, and an open wound, tenderness, swelling, or a bluish color at the injured site. Ask the victim these questions. Did you hear or feel a bone snap? Do you feel pain when you press on the skin over the suspected fracture? Are you unable to move the injured limb? If the victim answers yes to these questions, the person likely has a fracture. Before administering first aid, you should try to obtain the victim's consent. If the victim is unconscious, disoriented, or otherwise appears unable to knowingly grant consent, you can assume it's all right to proceed. So the next section will go into greater detail about a closed fracture, an open fracture, and how to treat those. So for a closed fracture, which is a simple fracture, is just a broken bone that does not cut through the skin. So you cannot see this. Call 911 or send for help immediately. Treat hurry cases, no signs of life. In adults, children, and infants, no signs of life and no pulse. Protect the spinal column and treat for shock. For an open fracture, which is an open wound that could occur from either the bone breaking the skin or an object going into the skin to break the bone. So you're going to see this. There is going to be blood. There is going to be obvious deformity with this. You can use a splint. If the victim must be moved, splinting a broken bone can help relieve pain and reduce the chances of additional injury. Use splinting only if necessary to stabilize the injured area and prevent it from moving and causing further injury and pain. Make the splint long enough to immobilize the joints above, below, and on either side of a fracture. Remember, above, below, and on the sides. So, like if you're out on a hike, the best way to do this is to find a large tree branch that you can measure. So, like in your book here, it shows a forearm. Find a stick that's going to immobilize up here all the way down here. So you want this to be like, you want it like this so that you can use your neckerchief and create a splint for it. Create a sling for it. But you want something that you can put a stick under here and tie around that. You don't want to tie it tight so that you cut off circulation, but you want to keep it to where they can't do this and they can't do this. That's what your goal is if you have a fracture right here. The same goes for a fracture of the lower extremity. So like your leg or ankle, you're going to want to splint above, below, and on either side of it. So again, finding a stick, a hiking stick, a walking cane, or a tree branch, whatever you have to do, tie that to that extremity that is broken to keep it immobilized. If you have like an upper leg fracture, you're going to need to stabilize around the hips and the abdomen as well. So always make sure, don't forget, if you have a fracture on your thigh, you're going to have to immobilize that hip joint by tying that splint from one side to the other. There's no way to really teach this on a video like this. So again, first aid is something that really has to be done in a classroom. So moving on to page 48, head, neck, and back injuries. The backbone is your spinal column. It's made up of all these small bones called vertebrae that surround and protect the spinal cord. If one of these gets broken, damaged, dislodged, anything like that, you could have serious damage all the way from your neck down to your buttocks. Like, that's how big that area is. You do not want to mess with that. If you suspect there's some sort of injury there, you need to get emergency help. Don't try to move these patients if at all possible. So, moving on to page 51 for cold and heat related conditions and injuries. We're going to take a pause right there. Okay, back to it, guys. Sorry about that interruption. Starting on page 52 with cold and heat related conditions and injuries. The human body works best if it has a constant temperature of 98.6 degrees. A person who is exposed to cold environmental conditions and loses body heat faster than it can be generated will be in serious danger. The person's body temperature may become too low to support life. Likewise, a person whose body has overheated and cannot cool itself sufficiently may die if fast emergency medical care cannot be found. These temperature-related emergencies require fast, life-saving first aid. Hypothermia. Hypothermia occurs when a person's body is losing more heat than it can generate. It is a danger for anyone who is not dressed warmly enough, although exposure to cold is seldom the only cause. Dehydration is a common contributing factor to hypothermia. Wind, rain, hunger, and exhaustion can further compound the danger. Temperatures do not need to be below freezing either. A hiker caught out in a cold, windy rain shower without proper rain gear can be at risk. A swimmer too far out in chilly water or a paddler who capsizes is also at risk for hypothermia. So for the first aid, signs and symptoms may be numbness, fatigue, irritability, slurred speech, uncontrollable shivering, poor judgment or decision making, and loss of consciousness. Shivering that stops without rewarming is a sign that a person's condition is worsening. He or she needs immediate medical care. Treat a hypothermia victim by preventing the person from getting colder. If fully conscious and able to swallow, have the person drink warm liquids. Move the person into the shelter of a building or a tent. Remove wet clothing. Get into warm, dry clothes. Wrap the person in blankets, clothing, or anything handy that can be used, like jackets or a sleeping bag. Wrap towels around water bottles filled with warm fluid. Then position those bottles in the armpit and groin areas. Monitor the person closely for any change in condition. Do not rewarm the person too quickly. For instance, by immersing the person in warm water, doing so can cause an irregular and dangerous heartbeat. Frostbite is a condition that occurs when skin is exposed to temperatures cold enough that ice crystals begin to form in the tissues. Signs and symptoms might be ears, nose, fingers, or feet feel painful and then numb. Sometimes the person will not notice any such sensation. Grayish white patches on the skin, indicating that ice crystals have begun to form in the top layers of the skin. With continued exposure, frostnip worsens and the freezing extends to deeper layers of the skin and the muscles. Frostbite can be very serious as it can cut off blood flow to the affected area and lead to gangrene or tissue death. First aid for frostbite: remove wet clothing, wrap the injured area in a dry blanket, get the victim under the care of a physician as soon as possible. Do not massage the area or rub it with snow. Rewarm the area only if there is no chance of refreezing. The next part is dehydration. The human body is 70% water, which is essential to maintain our body temperature. Vital organs like the brain and kidneys will not function without water. We lose water mostly by breathing, sweating, digestion, and urination. When we lose more water than we take in, we become dehydrated. Signs of dehydration include fatigue, increased thirst, dry lips, dark yellow urine. Moderate to severe dehydration includes severe thirst, dry mouth, little saliva, dry skin, weakness, dizziness, confusion, nausea, fainting, muscle cramps, loss of appetite, decreased sweating, decreased urine production, and less frequent or dark brown urine. First aid: to treat mild dehydration, drink plenty of water or a sports drink to replace the fluids and minerals. Drink 1 to 2 quarts of fluids over 2 to 4 hours. Avoid tiring physical activity, and you can look to about 36 hours to completely restore any lost fluids. Heat exhaustion can be brought on by a combination of dehydration and warm environment. It is not uncommon during outdoor activities conducted in hot weather, especially if participants are not fully acclimated to the conditions. Signals of heat exhaustion include severe lack of energy, general weakness, headache, nausea, faintness, and sweating, cool, pale, moist skin, and a rapid pulse. First aid is to get the person in the shade or an air-conditioned vehicle or building. Encouraged to hydrate, drink lots of water, sports drinks, cool wet towels or cloths to the skin, fan to help the person, to help the cooling process. Raising the legs may help prevent a feeling of faintness, and usually after 2 to 3 hours of rest and fluids, the person will feel better. The next section talks about heat stroke, which is much more serious than heat exhaustion. It can lead to death if not treated immediately. It can develop into heat stroke. In heat stroke, the body's cooling system begins to fail and the person's core temperature rises to life-threatening levels. One type of heat stroke develops in young, healthy people from dehydration and overexertion in hot weather, especially in high humidity. Signals of exercise-related heat stroke can include any signals of heat exhaustion as well as hot, sweaty, red skin, confusion, disorientation, a rapid pulse, shallow breathing, vomiting, and seizures. Call for medical assistance immediately. While waiting for medical personnel to arrive, work to lower the victim's temperature. Move the person to an air-conditioned or shady area. Loosen tight clothing and further cool the victim by fanning or applying wet towels. So, yeah, that's where we're at. We're moving on to page 56, talking about some burns. We're going to talk about the most common ones that we're going to see with scouting. A spark from a campfire, boiling water spilled from a pot, or a faulty wire, a mishap with chemicals in a science class, the rays of the sun on bare skin, all are causes of burns. Many are generally characterized by degree or the severity of the skin and tissue damage. First degree burns are superficial. So like if you touch a hot pan. Partial thickness is second degree burns, It affects the epidermis and part of the layer of skin below it called the dermis. These are more serious and include reddening and blistering of the skin. Some causes would be being exposed to boiling water. To treat these burns, remove the person from the source of the burn, cool the burned area with cold running water until the pain is relieved. Let the burn dry, then protect it with loosely applied sterile gauze pad and bandage. Do not apply ice water to any burn. Doing so may cause the body to lose heat rapidly and further damage the body tissues. Full thickness, which is third-degree burns, are very serious and life-threatening. They destroy the epidermis and the dermis. A victim who has been exposed to open flames, electricity, or chemicals may sustain full-thickness burns. The skin may be burned away and the flesh charred. If nerves are damaged, the victim may feel no pain. So this is how you know it's a third-degree burn. No pain. This is a medical emergency. Do not try to remove clothing. You can pull off skin if you pull off their clothes. You can cool the burn by applying cold, moist cloths. After cooling the burn, cover the area with dry, sterile dressings. Treat for shock. Shock is going to be a big thing with third-degree burns. And get immediate medical attention. Do not use ointments, burn creams that come in your first aid kits, anything like that. Do not use those. So it goes on to talk about chemical burns and electrical burns. Not really going to go over that in this video. Sunburn is a very common in scouting. It is a common injury among people who enjoy being outdoors. Most of the time it's going to be a first-degree burn, but if you are in the sun a lot more, it's going to be worse. It's going to get worse. It's best to just prevent this from the get-go. Use lots of sunscreen, apply it liberally and repeatedly. So if you're out on the water and you're swimming and you're in and out of the water a lot, you have to reapply that sunscreen. Don't forget, reapply sunscreen. Wear a broad-brimmed hat to cover your face, cover your neck. The neck is a very common area that people forget to put sunscreen. So some other important information with first aid is hyperventilation. It's what happens when you are breathing faster and deeper than your body needs. Involuntary hyperventilation may be caused by severe pain, infection, bleeding, heart attack, cold water immersion, diabetic coma, poisoning, or conditions such as anxiety attacks. The victim can feel dizzy or faint and have numbness, tingling, and or cramping in the fingers and toes. Involuntary hyperventilation requires immediate medical attention. Voluntary or deliberate hyperventilation is unhealthy and can be dangerous, especially if it is followed by breath holding. A person who does this can pass out or faint from a lack of oxygen before feeling the need to breathe. If this occurs while a person is underwater, the result can be drowning. Be alert to abnormal breathing patterns in individuals. So the next one is a loss of consciousness. So, you're going to go through your airway, breathing, circulation. Are they breathing? Is their airway open? Do they have a heart rate? What's going on here? You're going to ask yourself, are they diabetic? Are they having a heart attack? Are they having a stroke? Are they responding to you? Have they fallen and hit in their head? You're going to evaluate all of these and you're going to get immediate medical attention. Loss of consciousness, out on a hike in the middle of the woods. If you don't know what's going on, if the person is not a diabetic and they're not allergic to anything, you have to get immediate medical assistance. If they're allergic to spiders or bees and they carry an EpiPen, then your scoutmaster needs to be aware of that. Or if you're a grown person and out on a hike with somebody, you need to be aware of that stuff so that you can take care of them. Hey, my friend here is allergic to bees and she just got stung, but she has an EpiPen in her backpack, so I'm going to grab that and I'm going to follow those instructions and use it. A seizure is a change in awareness or behavior that is caused by abnormal electrical activity in the brain. In adults and children over 6, seizures are usually due to epilepsy, a disorder of the brain, could be a signal of a serious medical problem. Seizures can occur in a person who is suffering from a head injury, brain tumor, stroke, poisoning, electrical shock, heat stroke, infection, high fevers, low blood sugar, and low blood pressure. So all of these are reasons that you can have a seizure. If you're out in the middle of the woods and somebody starts having a seizure, you need to ask yourself, do they have any of these conditions? What's going on to cause this seizure to happen? Whatever you do, do not hold them down. Don't stick your fingers down their throat. Like, they will bite your fingers off and they have no control. Don't stick anything in their throat. Roll them on their side and ask yourself these questions. Do they need an EpiPen? Do they need sugar because they're a diabetic? What's going on here? Loosen any tight clothing. So if they're wearing a neckerchief and their scout shirt is buttoned all the way up here, loosen that up for them so they'll be more comfortable. And roll them up on their side if you can, just to help that circulation and that breathing. So, diabetes. Warning signals of low blood sugar include headaches, sweating, pale, moist skin, weakness, dizziness, shallow breathing, nervousness, and a rapid pulse. High blood sugar is extreme thirst, frequent urination, drowsiness, lack of appetite, and labored breathing. So most of the time, diabetics are going to be wearing a necklace or a bracelet or something that identifies them as hyper or hypoglycemic. So they're going to be prepared in the field if something like this were to happen. Do they need insulin? Do we need to check their blood sugar? Do I need to give them a piece of candy? Do we need some orange juice? What's going on here? So you can always evaluate and figure that out. So this next section talks about foreign objects in the eyes. Don't rip it out. Whatever it is, don't rip it out. Get some saline, see if you can flush it out with some water, some saline, anything like that, and get emergency medical attention if you can't get it out on your own. Nosebleeds typically look worse than what they really are. So, very easy. You pinch the bridge of the nose and you tilt your head forward and put your nose between your legs. I know that sounds really weird and really uncomfortable, but that's what you do. You pinch up here and you hold off that blood flow, like you stave it off so it's not coming out, and bend forward, put your nose between your knees. We're going to move on. To bites and stings. Very common in the field to have tick bites, spider bites, brown recluses, fire ants, bees, scorpions, and animal bites. So if any of these occur, you're going to want to wash them with soap and water. Clean the area. If you have a tick bite, you want to remove that tick with gloved hands, grasp it with tweezers, close to the skin, and gently pull until it comes loose. Don't squeeze, twist, or jerk the tick. You don't want to leave any body parts of that tick in the skin. Also, a good idea with tick bites is you save that tick, you wrap it up in a piece of tissue, a Ziploc bag if you're at home, whatever you have. Take a magic marker, permanent marker, anything that you might have that will write on the skin. Circle around where that red area is. That's going to help. If that area gets bigger and bigger and bigger, that's going to help know how that progression is going and how fast it's happening. So that way when you get to a doctor, if that happens, they will know what's been going on and about how long ago it happened. With any bites, again, soap and water. Snake bites. Oh my goodness, I am terrified of snakes. So, non-venomous snakes cause only minor puncture wounds and can be treated as such. Since they are not warm-blooded, they cannot carry rabies, so you're going to scrub it with soap and water, treat with an antiseptic, and cover with a sterile bandage. However, a venomous snake bite requires special care. The venomous snakes of North America are pit vipers and coral snakes. Pit vipers, including rattlesnakes, copperheads, and cottonmouths, have triangular-shaped heads with pits on each side in front of their eyes. Signals of a pit viper bite include puncture marks, pain, swelling, skin discoloration, nausea and vomiting, shallow breathing, blurred vision, and shock. Coral snakes have black noses and are marked with red and yellow bands side by side, separated by bands of black. They inject a powerful venom that affects the victim's nervous system. The signals of a coral snake bite include slowed physical and mental reactions, sleepiness, nausea, shortness of breath, convulsions, shock, and coma. The bite of a venomous snake can cause sharp, burning pain. The area around the bite might swell and become discolored. However, a venomous snake does not inject venom every time it bites. So here are the steps for treating the bite of venomous snakes. Get the victim under medical care as soon as possible so that physicians can neutralize the venom. Remove rings and other jewelry that might cause problems if the area around the bite swells. If the victim must wait for medical attention to arrive, wash the wound. If it is a venomous snake, wrap the area snugly but comfortably with an elastic roller bandage. Frequently check the area above and below the injury for feeling, warmth, and color. Check for snugness. A finger should easily but not loosely pass under the bandage. Have the victim lie down and position the bitten part lower than the level of the heart. Encourage the victim, who may be frightened, to stay calm. Keep providing assurance that he or she is being cared for, and treat for shock. Do not make any cuts or apply suction to the bite. Apply ice, apply a tourniquet, or use electrical shock, such as from a car battery. These methods could cause more harm to the victim or are not proven to be effective. Okay, so the last part here is going to be talking about airway, breathing, circulation, and oh wait, nope, we've got more here. Okay, so the next section on page 81 is the life-threatening emergencies. I am not going to go into detail on how to use an automated external defibrillator, also known as an AED. I'm not going to teach you how to do compressions. You need a first aid, you need a CPR class for that. And all scouts should be required, I think, to take a first aid class or take a CPR class because you will need it. You never know when you're going to need it. Okay, so next part is a heart attack. It's a life-threatening condition that causes death of or damage to the heart muscle. So what you're going to see with a heart attack is pain spreading to the shoulders, arms, neck, or jaw, unusual sweating, nausea, shortness of breath, and a feeling of weakness. Call 911 and get medical attention immediately. If you suspect someone is having a heart attack and this person is conscious, try to find out the following. Are they taking any type of blood-thinning medication? Are they allergic to aspirin? Do they have any stomach problems? Have they ever been advised by a doctor not to take aspirin? So they're asking this so that when the person can get to the doctor, they can help them a lot faster if they have those answers. If the answer is no to all of these questions above, when you call 911, emergency responders may advise you to offer the person 2 uncoated baby aspirin tablets. Aspirin must be used, not painkillers such as ibuprofen or Tylenol. Next, we're going to talk about stroke. It occurs when an artery to the brain either bursts or is blocked by a clot. When blood supply to the brain is interrupted, brain cells begin to die. So, sudden weakness, numbness to the face, arm, or leg, sudden confusion, sudden trouble seeing, sudden dizziness, sudden and severe headache with no known cause. Your acronym here is to think fast, F-A-S-T. Face, arm, speech, and time. Ask the person to smile. Watch for weakness on one side of the face. Ask the person to raise both arms. Watch for weakness or numbness in the limbs. Ask the person to say a simple sentence, such as, may I have a cookie? Time to call 911 right away if the person cannot perform any one of the simple tasks above or shows any other signals of a stroke. Be sure to note the time the signals began. So when someone is choking, you're going to have to learn the Heimlich. Like, you're going to have to do this in a class. Like, there's no way I can teach you this. Severe bleeding, first aid for bleeding. You're going to want to protect yourself. Put some gloves on and put pressure on that bleeding. Hold it tight. Wrap it up. Stop the bleeding. Anaphylactic shock. So this is going to be people who are allergic to bees and peanuts. That's happened really commonly. Your signs are going to be pain, redness, and a little swelling around the affected area. For more severe situations, it's going to be anaphylactic shock, such as swelling of the throat or tongue that restricts air passages and makes breathing difficult or impossible. Most of the time, if a person knows they are allergic to something that severely, they're going to have an EpiPen handy. So again, that's where you need to know your friends, you need to know your buddies. Are they allergic to these things? Where do they keep their EpiPen? And that is all I have for this. I hope you guys enjoy.